As time and gravity begin to show effects on your face, many people turn to plastic surgery. But there are new technologies and procedures coming out that are less invasive and only require a 24-hour recovery period. Dr. George Smith is a board-certified plastic surgeon, and his clinic Faces is located in Ridgeland, and he's joining me this morning to tell us more about the latest in facial technology. Thanks for being with us.
Well, thanks for having me, Laura.
And I actually got to go by your clinic yesterday and see some of these procedures, and we have some of that video if we'll go ahead and roll it. Just want you to talk us through exactly what you're doing and what this procedure is.
This procedure is called an AccuLift, and the beauty of it is very minimally invasive and done under local anesthesia and done with a very small laser that's probably about the size of, maybe the fourth the size of a soda straw. And here you see me liquefying the fat. It's a very precise laser. You can do very delicate work and totally remove the double chin and the jawline problems and even the jowl. And this is me just running this laser through the fat, and as I do that, it liquefies the fat, which is much better than the old liposuction because you get a much better contouring and you get much more fat removed, and you get, in essence, a much better long-lasting result.
So what is the difference between this procedure and say, cutting someone's face open and doing plastic surgery that way? What's the difference?
Well, the biggest difference is the whole field of facial aesthetic surgery is totally changing. And what's happening is we're doing less and less big operations and more minimally invasive stuff that you can do in the office, you can do under local anesthesia. And what that translates into is lower costs, quicker recovery.
That's what everybody wants to hear.
Exactly. And the biggest thing it translates into is a very natural look. Nobody looks like they've had plastic surgery. Nobody looks fixed. You don't look like someone else. You just look like the best you could look at your age. And in fact, in my practice, I tell people, I said, I'm not here to make you look a lot younger. I want you to look good. I want you to look fresh. I want you to look perky.
Right.
And so that's, in fact, I actually think the facelift is almost going to be non-existent in another 10 years. It's probably the last procedure I would do. There's so many other new things.
Options now.
That are.
Well, yesterday you also did, after that procedure, you did an injection of Sculpta, I believe is the name of it. What is that, and what does that offer people? For, a lot of women out there are curious about this.
Well, it's along the same line of what we've been talking about. It's very minimally invasive. In fact, it's only an injection. It's totally different from all the fillers we've been using that you've heard of. It is a delivery system to stimulate your own collagen. And so what we've learned about aging is not about sagging face. It's about volume loss. And women particularly lose bone. And they lose bone in the cheeks and the jawline. So what this does, you inject it along the cheek and bone in the office, under local, and with a couple of applications of that spaced about a month apart, all of a sudden you've got a correction that will last 2 to 5 years. So that's a significant improvement.
And you could see almost immediate results yesterday
absolutely.
When I was there, so that was pretty impressive.
Right, yeah.
And then also, Lindsay's talking about the hot temperatures this weekend. I'm sure people are going to be out on the reservoir. And, what's the most important thing? You get all these wrinkles on your face from going out and getting sunburned, right? So how can people protect their skin?
Well, the real, probably the number one thing if someone comes into my office is, what is the most important thing you can do? And I'd say sunscreen. And using, just common sense. Kids don't need to be out in the sun from 10 to 2. Everybody's out of school right now. They're all going to the beach. And the best advice I could give them is, listen, little kids don't care what they wear. Put a cap on them. Put a shirt on them. Put good sunscreen, 50 block, waterproof, and take care of their skin, because probably 80% of the damage you get to your skin you get before your 18th birthday.
That's impressive. Well, we actually have your information right there on the screen. That's for Faces. And we just want to thank you so much for coming by and telling us about all the new technology. It's really impressive.
Well, thank you.
Thanks for being with us. Well,